The narrative that I'm trying to capture and help people understand is we don't know everything about the brain, right? Nobody's claiming we know everything about the brain. It's such a wild frontier of medicine that to have conclusive statements that are 100% science, it's very hard to do that in our industry in psychiatry and mental health. And so, how can we be more open to just different perspectives? And a recent post that I got involved in, and again, this is affecting my mental health a little bit. So I'm putting an end on how much I'm diving into these comments.
Yeah.
Um,
Yeah.
but a recent one that caught some controversy was an ADHD post that said there was an article claiming that 2 hours of phone use can cause ADHD, and everybody was just upset about the fact that someone's claiming you can catch ADHD or it can be caused by electronics. And my comment was simply that there is a genetic predisposition. We assume, we hypothesize. We don't know 100%, but we think the data is pretty consistent on that side. But that's a small piece of the puzzle. And if we overfocus on the genetics, then we're discounting all of the other things that go into something like ADHD, which there's so many other physical components. There's so many psychological components. There's so many environmental factors. But what I'm understanding is the narrative is you either have to be born with it or not. And then these other things maybe bring it out of you, but you have to have been born with it. And that's really hard for me to digest in this space as a psychiatrist and an educator, because I don't want to say I disagree, because I don't think we should be debating who's right or wrong. But I think there's another perspective that we only created these diagnostics recently, according to a diagnostic statistic manual. And we've seen rampant numbers of increase in diagnostics because of it, which the science says, yeah, like you start to look for something, you're going to see more of it. I don't think that's enough, though, to explain why this is such a societal problem. When I'm doing the work, seeing thousands and thousands of patients, and they come in complaining about poor focus, ADHD-like symptoms, we don't really have too many other differentials on the list.